Hi, and welcome to the Sustainable Healthcare Spotlight's Critical Thinking and Research Workshop. My name is Harveen. I'm one of 4 outreach coordinators and studying psychology.
My name is Regina. I'm a fourth year kinesiology and health science student, and I'm also an outreach coordinator for SHS.
Hello, everyone. My name is Omam. I'm a fourth year student in kinesiology and health science, and I'm also an outreach coordinator as part of SHS.
Hello everyone, my name is Kathy and I'm a third year kinesiology and health science student. I'm one of the 4 outreach coordinators for SHS. So now let's start with what is critical thinking?
So, what is critical thinking? Critical thinking means being able to look at facts, ideas, and opinions with an open mind and an unbiased point of view. Basically, being able to look at problems and ideas with an open mind and trying to understand things from different points of view, aka a paradigm shift. So, why does critical thinking matter? Um, Critical thinking involves engaging in thorough literature reviews, identifying gaps and inconsistencies in existing research. Critical thinking also involves understanding how power relations, privileges, and stereotypes perpetuate inequalities and prejudices that can be reflected in research studies, which can all negatively impact marginalized communities in research. So there are many different types of research. There is qualitative research, and qualitative research is being able to examine and describe phenomena that are difficult to mathematically quantify and analyze. It involves a smaller population of subjects studied, and it allows in-depth insights into a topic or problem to generate new ideas for research. There are different types of qualitative review. For example, one-on-one interviews, which involve conducting in-depth interviews by asking open-ended questions and collecting data from a cohesive story. Focus groups involve recording a discussion amongst participants to gather unbiased thoughts and opinions. And ethnographic research involves experiencing the research environment and collecting data through interacting with subjects for an extended period of time to closely observe participant behavior. And then finally, qualitative observation, which involves observing participants from afar in an effort to analyze and explain and understand their behavior. And next, we have quantitative research, which involves focusing on data that can be measured. It specifically explores a phenomenon through numerical data collection, measuring them using mathematical, statistical, and computer-aided tools. It is used to test or confirm theories and assumptions, and some examples of quantitative research include closed-ended questions, surveys, and experimental studies. Next, in the types of research, we have primary versus secondary data. So primary research involves research that is the collection of original and first-hand data. Secondary research involves the analyzation and interpretation of already existing data. And examples of secondary research can include meta-analyses as well as systematic and literature reviews. For types of studies, we have observational and experimental data. So observational studies involve studies that involve observing a population from afar to record results. And experimental studies are used to study causal relationships by manipulating and controlling one or more independent variables to measure their effect on one or more dependent variables. Next, we have descriptive versus analytical studies. Descriptive studies involves research that systematically describe a population, a situation, or a phenomenon. It is used to identify patterns and trends for disease and injuries by focusing on answering what, when, where, and how questions, and not why questions. Which is where analytical studies comes in, and it aims to answer the why questions in an effort to explain a phenomenon to determine causes, like the relationship between exposure, like smoking, and disease, lung cancer. There are different common study types and their strengths. So for example, meta-analyses and systematic reviews. A meta-analysis is a statistical technique that integrates the finding from many different research studies to describe the differences between study designs And a systematic review is a comprehensive summary of existing research on a specific topic following a structured methodology to minimize bias. And these studies, systematic review and meta-analyses, provide the highest level of evidence by synthesizing findings from multiple high-quality studies, and therefore they provide the strongest evidence. Next, we have randomized controlled trials, which are the gold standard for testing interventions. And the reason why is that they are an experimental study in which participants are randomly assigned to either an intervention or experimental group or a control group. And this method minimizes bias and confounding variables, making it the most reliable way to determine the effectiveness of a treatment or an intervention. For cohort and case studies, they are useful but provide weaker evidence. And the reason why is cohort studies observe a group of individuals or a cohort over a period of time to examine and understand how modifiable and non-modifiable factors affect disease risk. For example, looking at the association between exposures like smoking and their outcomes like lung cancer. Case control studies also compare individuals with a specific condition, like cases, to those without it, the control group, to identify potential risk factors. While these studies help establish associations, they do not provide causations as effectively as randomized controlled trials. And then finally, we have case studies and expert opinions. They are the least strong, but still valuable. And that is because case studies provide an in-depth description of unique or rare medical cases, offering insights into potential treatments or disease progressions. And expert opinions rely on the clinical experience and judgment of specialists in a field. And although these resources are useful for generating a hypothesis, they lack the rigor of higher tier studies and are more prone to bias.
Great. Now that we've covered the different types of research and varying strengths amongst these types of research, let's discuss how to conduct a research study, starting with theory. What is a theory? A theory is a broad, well-supported explanation of natural phenomena based on a large body of evidence. Note, theories aren't guesses. They're developed over time through repeated testing and observation. A scientific theory can help explain why something happens and predict future occurrences. An example of a theory is the germ theory of diseases. This theory is supported by years of research and explains why infections spread. Let's contrast theory now with a hypothesis. What's a hypothesis? A hypothesis is a testable and specific prediction based on existing knowledge. Hypotheses, plural, must be falsifiable, meaning they can be tested and proven wrong if incorrect. Hypotheses are framed as if-then statements. Below we have a null hypothesis example. If hand washing reduces bacterial infections, then hospitals that enforce strict hygiene will have fewer cases of infection. What separates a good hypothesis from a bad hypothesis? Pause now to reflect. Let's discuss now the structure of research studies. We'll first start with a literature review. Now, a literature review provides information regarding topic and includes summary of past research, meaning what's already known, gaps in knowledge, what's unknown or controversial, and research questions, including hypotheses. So what is this research study trying to discover? Next, we have methodology. The methodology of a research study explains how the study was conducted so others may replicate it and includes design, participants, variables, procedures, and ethics. Results and data analysis. The results and data analysis section presents the data prior to manipulation and includes tables, graphs, and statistical tests, trends, patterns, or significant differences. Please note that you will not be submitting your raw data in this section. An example of results and data analysis includes the group that received the treatment had a 30% lower infection rate than the control group. The fourth and last section of a research study is discussion and conclusion. Now, this section interprets results and relates them to existing research, including what do the results mean? Were the findings expected? What are the strengths or weaknesses of this study? What future directions may research take? Determining the study's strength. First, we'll examine meta-analyses and RCTs versus observational studies. Let's ask, why are meta-analyses in randomized controlled trials stronger than observational studies? Meta-analyses combine multiple studies, thus reducing bias. In randomized controlled trials, RCTs, use random assignment, also reducing bias. The idea is to reduce bias as much as possible for a strong study. Next, we'll examine sample size and methodology. What's the effect of sample size and methodology on reliability? Well, the larger the sample, the more reliable the results. For example, a study on 10 people is less reliable than a study on 10,000 people. Regarding methodology, blinded studies, meaning participants don't know which treatment they're receiving, reduces bias. And controlled variables ensure that the only difference is the treatment being tested.
Thank you so much, Harveen. It was great having you. So now let's discuss how to evaluate research effectively through the lens of critical thinking. So in science and research, it's not enough to accept a study's result at a face value. So to truly understand and assess the validity of a study, we need to consider several important factors. So the first part of critical thinking in research is question assumption. Well, what is a question assumption? So remember, every study is based on certain ideas or beliefs. So we should question these to make sure that research is trustworthy and precise. So when we are looking at research, we need to be questioning not just about the result or the outcome, but about its entire process. So a good question to start with would be, why was this study done? What was the purpose? What do we gain from them? So these might be some good questions to start with. So during a funding for a research, when it comes from an industry that benefits from a certain outcome, it might actually influence the outcome in many possible ways. So that is a huge red flag. But partiality isn't always intentional because it may come from how a study is designed, who participates, or even how the results are explained. So instead of taking research at a face value, we need to learn to dig deeper and deeper and compare multiple studies and think more critically about the bigger picture it will provide us. So to make it more clear, let's have an example. When a soda company is funding a study on sugar's health effects, it is partial because it has a financial interest in the outcome. So if the study finds no harm, soda sales could increase. But if the sugar is shown to be harmful, it could hurt the growth and its profit. So this financial stake may influence the study's design, the data interpretation, or publication, which might lead to unfair results that favor the company's goal instead of proving and providing an objective assessment. The second part of critical thinking is logical failure. What is a logical failure and how will it affect our research? So logical mistakes like confirmation partiality or appeal to authority can significantly impact a research by twisting its finding and then leading it to a false or misleading conclusion. So here's how it can actually affect some research. Some common one, it may include the strawman argument, selective perception, and appeal to authority. So the strawman argument is where it is the misrepresentation of an opponent's argument to make it easier to attack. So in this way, the twisting of the argument to make it seem weaker so that it's easier to criticize. So this tactic actually ignores the real point of the argument and may trick others into thinking and believing that the opponent's position doesn't make any good sense. And the second one is the selective perception. It is the process of which on focusing on certain information that aligns with your belief or interest on your research while ignoring information that does not align with your interest. So this means that the researchers might focus only on data that agrees with their ideas and then ignore data that goes against it. In this way, the result may lead to false conclusions that do not reflect the true nature of the research question. And the third one is the appeal to authority. Appeal to authority means assuming something is simply true because an authoritative figure or an expert says it, but without critically evaluating the evidence. For example, relying too heavily on an authority figure opinion, which might lead to limiting our critical thinking abilities, which might in fact lead to an invalid conclusion. So remember not to adjust in research. Not just in research, but in every field, evidence is very important because these logical mistakes may lead to a scientific community, create faulty policies, and then leading to a misstudying of a topic. For research to be reliable, it's essential to focus on evidence and logical reasoning than the authoritative claims. The third part of critical thinking is the factors of a study. So, when evaluating research, it's important to consider the factors. Like these includes how many studies support the result, whether the finding can be repeated by others, and if the study challenges the previous research. So, by understanding these factors, we can better judge the reliability and significance of the study. To start with, we have the replication, contradictory evidence, and the specific group. So the replication is the key part where a scientific method ensuring the research findings are reliable and can be reproduced by others. It's in simple words, it's all about the researchers do not get the same result, the study might not be reliable. And the contradictory evidence is when you're doing a study, you need to learn that if a study's result goes against a lot of previous research, please ask yourself, does this bring a new perspective, or is it just something an outliner? Or is it a new discovery, or it's just an exception? It could be anything. So the specific group or situation is where the research finding might not apply to everyone. Because check if the study's results are relevant to a specific group or situation being discussed. The fourth part of critical thinking is understanding the difference between correlation and causation. Correlation is where two things happen at the same time or are related, but it doesn't necessarily mean one causes the other. And why does it matter? Because correlation matters since correlation alone doesn't prove a cause. There could be a third factor that influences both the events. For example, ice cream sales and shark attacks both increased during the month of summer. So while these two events seem to be linked, one doesn't cause the other. And causation means that one event directly causes the other. In simple words, one thing happens because of the other. For example, when you press the start button on an elevator, it causes the elevator to move. So this is causation because the button directly leads to the elevator moving. So to clarify more about the ice cream and shark attack example, why do you think it actually happens? So during the month of summer, both the ice cream sale and shark attacks increase. However, it would be wrong to assume that eating ice cream causes shark attacks. But then what is the real cause? So the real cause of both the events is the hot weather. So during warm temperature, we just go to the to the seas out there to swim, and because of the warm temperature, right? And at the same time, these warm temperatures also make people to buy more ice creams to cool down. So the real cause is the hot weather and not the shark attacks of ice cream sales. Why do you think it is important to know the difference? Due to misleading conclusions, it's important to know the difference. So if we mistakenly think that eating ice cream causes shark attacks, we might take actions like banning the ice creams near beaches, which doesn't actually solve the real issue because the real issue is hot weather and swimming habits. So it's critically important to think that understanding the difference between correlation and causation helps us avoid making false assumptions and encourages us to think more deeply about why events happen. So the key point here is that just because two events happen together doesn't mean one caused the other. It could be a coincidence or an influence any other factor, not limited to weather. To further understand causation, it is important to know how to determine causation. So to prove that one thing directly causes another, researchers use various methods, and we're gonna see the first three and main important methods. At first, just recall what I said about causation. So the first method is experiment with controlled variables. So this is where the researchers control or keep certain factors the same to see the effect of one thing. For example, the RCT study design helped to isolate the effect of one factor by randomly assigning participants to different groups. For example, when a researcher wants to test a new drug that actually lowers the blood pressure, the researchers randomly assign patients to two groups. One group would receive the real drug, and the other would receive something that looks like the drug but doesn't actually affect the blood pressure. So, if only the drug group sees a lower blood pressure, the drug is likely the cause. And the second one is eliminating confounding variables. So, it means about identifying and removing factors that could affect the results of a study. So, researchers can be sure they are identifying the true cause. For example, in a study showing people who exercise are more healthier, the researchers need to consider if other factors like genetics, lifestyle influence the research. By controlling these other external factors, researchers can actually determine if the disease itself is the problem or exercise itself may cause to a better health. And the last one is multiple studies. So looking at patterns across multiple studies rather than relying on just one to confirm a cause and effect relationship. So, for example, one study might suggest that drinking coffee reduces the risk of heart disease, but if 10 other studies find no link, it's likely a coincidence rather than causation. So, strong conclusions require multiple studies with consistent result. So the next one is logical flow and problem solving. So the researchers must end with clear findings and actionable solution. To be effective, the solution needs to directly address the problem identified by the researcher. So if the solution doesn't target the root cause or align with the problem, it's not going to work. There are a few steps that involved in problem solving. So the first one is to identify the problem. That is to clearly define the issue based on research. And the second thing is to gather evidence. So use strong research to support your argument. Third one is to analyze data critically. Make sure the data is interpreted without partiality. Fourth one is to develop a solution. Solution should be backed by evidence and practical for implementation. As I told you before, no matter which field you are in, evidence is crucially important. Support with additional research. Show how similar approaches have worked in other contexts or other factors. So in simple words, show how similar solutions have worked in other situations. Let's say research shows that students with high stress level tend to have lower academic performance. So the proposed solution here is increasing study hours. But this is misguided because it doesn't actually or directly address the root cause. And what is the root cause here? The root cause here is the stress. So in this case, the research suggests that stress is the issue. So the solution should be to focus on managing or reducing the stress rather than simply increasing the workload. So this highlights how important it is to ensure that the solution directly addresses the problem identified in the research. So to sum up, we need to remember every argument should be supported by evidence. Avoid jumping to conclusion without proper justification. Logical reasoning ensures that research findings lead to meaningful and effective solutions.
Okay, everyone, moving on to applying research to your projects. So finding reliable sources. So Google Scholar and PubMed are really good sources, and they're great for starting points for finding academic articles and peer-reviewed studies. Next, we have academic journals. With academic journals, make sure that they're peer-reviewed journal because they ensure a lot of credibility. Look for well-established journals that focus on the topic that you're researching about. And in the end, how to check if a source is credible. You want to check the author's credentials and if the article is peer-reviewed. The more citations, the better the publisher and the stronger the source. Moving on. So, for example, if you're researching about physical activity and why it's important, you want to make sure to use evidence and data that shows the research studies that would support your claims. So when you're doing that, remember there are a lot of possible studies to explore. So systematic reviews, experimental research, statistical significance, and longitudinal studies. So there are common mistakes and solutions. Starting off, overgeneralization. You want to make sure that you don't overgeneralize. Just because a study shows a certain result, it doesn't mean it applies to all situations. And that also goes into the fact of correlation vs causation. That correlation doesn't always imply causation. You want to look for evidence that is one factor that causes the other, such as through randomized trials. We also have cherry picking data. So you want to avoid selectively reporting data that not only supports your argument, but also always presents all relevant findings, and not considering opposite viewpoints. It's important to consider opposing studies and viewpoints, and this strengthens your conclusion and ensures a more balanced view. You want to critically analyze opposing studies to get a final decision in the end.
Thank you for attending today's session. We hope that the critical thinking and research workshop was beneficial to you. Now, if you have any questions, please ask your teacher. However, if you require our assistance, please do not hesitate to contact us. Thank you.